Parent University is a series of resources provided for parents by the Muscogee County School District Parent Advocacy Center and the Program for Exceptional Students in partnership with ChanceLight Education. Our Parent University supports students and families outside of the classroom by providing specific educational trainings and resources to parents which assist them in navigating and supporting their students' education. My name is Stephanie Waller, and I am a counselor for ChanceLight Education. I'm pleased to offer you this webinar today, May 19th, 2020. Families across our country are adapting to the evolving changes in daily life caused by this pandemic. Our schools, places of public gathering, and non-essential businesses are closed. Parents and other caregivers are faced with their families adjusting to the new normal. This includes trying to keep children occupied, feeling safe, and attempting to keep up with schoolwork as best as possible. None of this is easy, but it helps to stay focused on what is possible in order to reinforce a sense of control and to reassure our children that they are okay and the situation will get better. Let's get started. First, let me introduce to you the ladies that helped create this presentation. These are our mental health therapists. We have Miss Audrey Wardlaw, Chris Dawkins, and Wiley McGruder. What is mental health? We can all come up with words that pop into our minds that we associate with mental health. We might think of a friend or family member we know and love that may have had some mental health struggles in the past. One may also think about the news and how the importance of mental health has been brought to the forefront at the time of this quarantine. One might also go to a time in your own life when maybe you weren't feeling great mentally and you were having your own personal struggles. It is very common as a large part of the population will have some form of mental health concern during their lifetime. A state of well-being. One can achieve a state of well-being in many ways. It may look different for every individual. The ability to cope with normal stresses of life. One will need to learn the proper way for them to cope with the stresses in their own life. One may also need to learn how to create healthy choices for themselves. People will want to be able to contribute to their community. A sense of involvement in one's community can be very important. Humans thrive on socialization. We want to feel loved, needed, and that we are doing our part in the community. What is good mental health? Good mental health is a positive view of oneself. Low self-esteem can cause many problems in a person's life. Understanding one's value can help in many aspects. A healthy diet, exercise, and also getting screened for diseases and learning coping strategies can all enhance a person's health. Treating your body with care is a very valuable lesson to learn early in life. Our bodies react to how we treat them. It can start with a healthy diet, getting enough sleep, and making sure that all annual exams are attended. Getting screened for diseases and knowing how to deal with stress is believed to help one live a longer, healthier, and happier life. What does it look like? Good mental health is the ability to enjoy life, bounce back after difficult experiences, achieve a balance in one's life, be able to adapt to adversity, and feel safe and secure to achieve your own potential. There are many challenges of mental health. Around 1 in 5 students in the world may have a mental health disorder at some time in their life. 1 in 5 is a large number when we consider how many students can be in a classroom at one time. In a classroom of 20 students, there could be 4 who are dealing with mental health concerns. Depression is one of the leading causes of disability. Depression symptoms can range from irritability, lack of focus, and apathy. One may not have the desire to do things that they once enjoyed. They may also show symptoms of a low self-esteem as well as appear sad or withdrawn. About half of mental health disorders begin before the age of 14. Knowing that mental health disorders can have an onset before the age of 14 is very important. This means that we need to understand that our children could show symptoms before they become teenagers. We need to be aware of mental health disorders and what their symptoms are. Understanding what to look for and how to get the help one needs may alleviate some of the burden that mental health disorders bring on. COVID-19 and its mental health effects. During this pandemic, we have seen a lot of different reactions. One of the main ones is anxiety. This can be seen as fear or worry about one's health. There could be sleeping changes, eating, or lack of concentration, worsening of chronic health problems, or increased use of alcohol, tobacco, or other drugs. Depression, like we mentioned earlier, has also been seen on the uprise. Depression symptoms can be seen as sadness, hopelessness, or irritability. Also, eating and sleeping changes, feelings of worthlessness, uselessness, or guilt, showing signs of self-injury or self-destructive behavior. We are also seeing signs of agoraphobia, which is fear and avoidance of places or situations, feeling trapped, helpless, or embarrassed. Social phobia. This can be seen as everyday interactions, increased anxiety, fear, and self-consciousness, and fear of being scrutinized or judged by others. What are coping skills? Healthy coping skills increase our ability to be able to function in everyday life. Coping skills can be seen as diversions, such as using one's phone, writing, or playing games, social or interpersonal, communicating with friends or loved ones. Tension release. This can be done through exercise, crying, or laughing. Physical ways to help yourself. This can be seen as sleeping enough, eating healthy foods, and maybe the occasional chocolate. Spiritual needs can be met by meditation or religious ways. Limit setting. This can just mean scheduling some time for yourself, time to relax. Coping skills for children can also be seen as doing worksheets, board games, webinars, learning a new skill, and reading a book. So what is counseling, and can counseling help? Counseling can help us to feel accomplished in our mental health. Wellness can help us to increase our education and career goals. As far as ChanceLight, we offer individual and group counseling with our students. COVID-19 resources. We have listed the Disaster Distress Helpline, how to find a treatment facility near you, the National Suicide and Prevention Helpline, Behavioral Health Treatment Centers located near you, the National Helpline, and the Crisis Text Line. These are some more resources that we used to create this webinar today. We also have the National Alliance on Mental Health, the Georgia Crisis and Access Line, New Horizons, the National Suicide Line, the Bradley Center, which is the local mental health facility, and the Pastoral Institute, which can be used as family counseling, individual counseling, and couples counseling. Thank you again for logging on to Muscogee County School District and watching this webinar today. We at ChanceLight Education are here for you and your families.